If you've been told your sensitive teeth are just from getting older, the real question isn't whether to switch to a sensitivity toothpaste. It is what part of your tooth is exposed and why. I'm going to tell you something most dentists won't pause long enough to say out loud. Tooth sensitivity is not a personality trait. It is not something that just shows up after 50. It is a signal, a very specific, very loud signal, that the protective layer of your tooth has been breached somewhere, and your nerve, which has no business being touched by cold water or warm coffee, is being touched. In 25 years of practice, I've watched thousands of patients accept sensitivity the way they'd accept gray hair, when in fact it was telling them something fixable was getting worse. By the end of this video, you're going to know exactly what's actually causing yours, why most sensitivity toothpastes mask the problem instead of solving it, and the steps that have worked in my chair on patients who thought they just have to live with it for the rest of their lives. I'm Dr. Helen Bennett, 25 years in practice, the last 15 as a biomimetic and holistic dentist, which means I focus on saving teeth and treating the mouth as part of the whole body. Before we get into this, do me a small favor. Drop your city or state in the comments. I love seeing where you're watching from, and it tells me who I'm sitting with today. And one important thing, everything I share is educational. It's not a substitute for in-person dental care. Use it to have a more informed conversation with your own provider and to walk into your next appointment knowing what to ask. With that out of the way, let's actually understand what sensitivity is. Here's what's at stake when sensitive teeth get ignored, or worse, masked with a tube of paste from the drugstore. The clinical downhill is quiet, but it's real. Sensitivity almost always means one of two things. Your enamel is wearing thin, or your gum is receding and exposing the root surface. Both of those are progressive. Neither one stops on its own. A small area of exposed dentin becomes a larger area. A larger area picks up decay more easily because the root surface of a tooth is far softer than the crown. What started as a wince when you sipped iced water becomes a small cavity at the gum line, becomes a filling, becomes a bigger filling, becomes a crown, becomes, and I have seen this many times, a root canal, because the nerve was so chronically irritated that it eventually died. There is also the systemic side. People with sensitivity often stop eating cold foods, hot foods, sweet foods, sour foods, anything that hurts. Their diets narrow, often without them noticing, sometimes for years. They avoid raw vegetables, fresh fruit, anything textured. Nutrition slips. The gut suffers, energy falls. None of that is being tracked by anyone because it is hidden behind a $7 toothpaste that promised relief. I don't tell you this to scare you. I tell you because no one else will, and the irony is that most cases, caught early, can be improved or fully resolved without drilling anything. And about halfway through, I'm going to give you a 30-second test you can do tonight to figure out which of the 4 real types of sensitivity you actually have, because the right fix depends entirely on the right cause. Stay with me. Let me back up and actually explain what's happening when a tooth hurts. A tooth has 3 layers. The outer shell is enamel, the hardest substance in your body. Underneath the enamel is dentin, which is softer and shot through with thousands of microscopic tubes that lead directly to the nerve in the center of the tooth. Those tubes are called dentinal tubules, and they are the entire story of sensitivity. When they are sealed by enamel above the gum line or by cementum and gum tissue below the gum line, the nerve stays quiet. When they are exposed to air, to temperature, to acid, to pressure, the fluid inside them moves, the nerve registers it, and you feel a sharp electric jolt. That's sensitivity. It is not the toothpaste's fault. It is not your nerve being dramatic. It is a barrier that has been broken, somewhere, somehow. Now, and this matters. There are essentially 4 ways that barrier gets broken, and the standard line in many dental offices is, try a sensitivity toothpaste. You'll get used to it. I'm not going to do that to you. I'm going to walk you through the 4 causes, because the right answer depends entirely on which one is yours. The first is enamel erosion. This is acid wear. It happens when the surface of the tooth is dissolved by acid coming from outside the body. Citrus, soda, sparkling water with lemon, wine, vinegar dressings, kombucha, or from inside the body, which is silent reflux that very few people know they have. Erosion looks specific on a tooth. The biting surfaces look slightly cupped. The fronts of the front teeth look thinner, slightly translucent at the edges. Your dentist can see it under magnification. The fix is two-part. You stop the acid, meaning you change the timing of acidic foods. You do not brush within 30 minutes of consuming them. And if there is any chance of reflux, you have a real conversation with your physician. And you support remineralization, adequate vitamin D, calcium, and phosphate-rich foods, hydroxyapatite toothpaste in many cases, and waiting for the saliva to do its work between meals. The second is gum recession. This is the most common cause I see in patients over 50, and it is the most misunderstood. The gum has pulled away from the tooth, exposing root surface. Root surface has no enamel, only a thin layer of cementum, which wears away easily, and the dentinal tubules underneath are wide open. Cold water hits, the tubules respond, the nerve fires. The cause is almost never aggressive brushing alone, even though that is what most people are told. The deeper cause is usually a combination. Gum disease that has thinned the tissue, grinding or clenching that has stressed the gum line, the way the teeth meet when you bite. Sometimes a hard-bristled toothbrush over many years, adding to the picture. The fix is layered. Switch to a soft bristled brush immediately. Re-angle the brush at 45 degrees into the gum line. Gentle, small motions, never scrubbing. Treat the gum disease if it is present. Get evaluated for grinding, and I'll come back to that. In some cases, a biomimetic dentist can do a conservative gum graft or a glass ionomer restoration over the exposed root that seals those tubules without grinding the tooth down for a crown. The third is what I call mechanical exposure, and this is one of my biggest pet peeves about my own profession. Reflex use of full crowns when partial coverage would have done the same job, with the crown margins sitting right at the gum line, irritating the tissue and exposing dentin underneath. Old fillings that have settled and now have a tiny gap at the edge. Aggressive scaling that has removed cementum from the root surface. Whitening procedures done too aggressively or too often, which open up the tubules temporarily, but sometimes for weeks at a time. If your sensitivity started after a specific dental procedure, it is not in your head. It is real, and you should not be told to give it time. You should be told what was done and whether it can be revised. Now here's the part that's going to surprise you. The fourth cause has nothing to do with the surface of your tooth at all. It is a cracked tooth. Cracked teeth are the most missed diagnosis in all of dentistry. The crack is often invisible to the naked eye, sometimes invisible even on X-ray. The tooth feels fine when you bite straight down, but a sharp pain shoots through it when you release, or when you bite something hard, or when cold hits in a specific spot. Patients describe it as weird, not really pain, just a zing, only when I bite a certain way. That is a cracked tooth until proven otherwise, and ignored cracked teeth are the leading reason teeth break in half and become unsavable. If you have a sharp, intermittent, location-specific sensitivity, especially on a back tooth, especially on a tooth that has had a large old filling, do not let anyone hand you a sensitivity toothpaste and send you home. Ask for a bite test, ask for transillumination. That's a bright fiber optic light shown through the tooth, and ask for magnification. Here's the test I promised. Tonight, take a sip of cold water and pay attention. Does the pain hit the moment the water touches and stop the moment it passes? That's the open tubule pattern, which means erosion or recession. Does the pain linger for 30 seconds or more after the water is gone? That suggests a deeper inflammation of the nerve, which is more serious and needs a real evaluation. Does the pain only happen when you bite or release on a specific spot? That's a crack until proven otherwise. Does it happen across many teeth at once, in a generalized way? That suggests grinding, clenching, or systemic acid wear. That single 30-second test will tell you more about what kind of sensitivity you have than 5 visits to a rushed office ever will. If you only remember one thing from this video, let it be this. Sensitivity toothpastes work by clogging up the tubules with potassium nitrate and other compounds, which is a fine temporary fix, but it does nothing about why those tubules were exposed in the first place. You have not solved the problem. You have hit mute on it. So what actually works at home, without drilling anything, depends on which cause is yours. For erosion, you change the timing and frequency of acidic foods. You treat any reflux. You use a hydroxyapatite paste. You check vitamin D, and you give the saliva time. For recession from gum disease, you treat the gum disease. Daily salt rinse, soft bristle brushing at 45 degrees, slow and careful flossing every space, every night. For grinding and clenching, you address the cause, which is sometimes stress, sometimes airway issues at night, sometimes how your teeth meet when you bite. And a properly fitted night guard from a biomimetic dentist, not a drugstore boil and bite. For a suspected crack, you do not wait. You get it evaluated. Now, here's where the gap comes in. There are deeper interventions for sensitivity. Desensitizing fluoride varnishes, glass ionomer, or biomimetic restorations over exposed roots, ozone treatment of pockets, conservative gum grafting techniques that have come a long way in the last decade. Those require a trained biomimetic or holistic dentist, and they are absolutely worth asking about if home protocols haven't moved the needle in 8 to 12 weeks. I won't walk you through them in detail, because the diagnostic part really matters. But the right fix for the wrong cause does no good. Let me tell you about a woman I'll call Margaret. 64, retired nurse, came in, convinced she'd developed old teeth because nothing cold or hot felt comfortable anymore. She'd been using 2 different sensitivity toothpastes for almost 3 years. When we mapped her mouth, what we found was a story. She had been brushing horizontally with a medium bristle brush for 40 years. She had moderate gum recession on every tooth from canine back. She drank a glass of orange juice every morning and brushed her teeth 10 minutes after, every day, for decades. And she had been clenching her jaw at night without knowing it, because her airway was partially blocked by chronic congestion. We did 4 things. Switched her brush, retrained her angle, moved the orange juice too, before brushing, with a water rinse and a 30-minute wait, got her evaluated by an ENT for the airway and a sleep doctor for the clenching, then made her a properly fitted night guard, added a hydroxyapatite paste. 3 months later, she ate ice cream for the first time in a decade. She told me about it like she'd won something. Margaret's case is not unusual. Most of my sensitivity cases have 3 or 4 causes layered on top of each other. Solving one helps. Solving the layered combination is what changes someone's life. Here's what 25 years in practice have taught me about sensitive teeth. They are almost never just sensitive teeth. They are a story about how this particular mouth has been worn, brushed, ground, eaten in, and dentally treated over a lifetime. And the story is readable if someone takes the time to read it. The patients of mine who simply accept sensitivity as their new normal are the ones who quietly slide into bigger problems over the next 10 years. The patients who treat the wince as a question, which one of the 4 causes is mine, and what's the layered version of the answer, are the ones who walk into their 70s eating whatever they want. You do not need to live with this. You do not need a stronger toothpaste. You need a real diagnosis. And you do not need permission to ask hard questions about why no one has explained any of this to you before. The most powerful tool in the dental chair isn't the drill. It is the question you ask before it touches your tooth. Let's pull this together before I let you go. Sensitive teeth are not normal. They are a signal that the dentinal tubules in your tooth are exposed, and that exposure has one of 4 real causes. Enamel erosion from acid, gum recession from gum disease or grinding, mechanical exposure from old or aggressive dental work, or a cracked tooth that almost no one is checking for. Tonight, do the cold water test and pay close attention to whether the pain is sharp and quick, lingering, location-specific, or generalized. That single observation will tell you which cause is most likely yours and which set of changes to start with. Switch to a soft bristled brush at 45 degrees immediately. Move acidic foods and drinks away from your brushing time and rinse with water and wait 30 minutes before brushing after them. Treat any gum disease with the salt rinse and slow flossing every night. Get evaluated for grinding and airway issues if either is suspected. Ask for transillumination if any of your sensitivity is sharp, intermittent, and location-specific. And do not, please, ever agree to a full crown for a sensitive tooth without asking what conservative, partial coverage, biomimetic options exist. You are not a passive patient. You are an active participant in your own care. The dentist holds the instruments, but you hold the choice. In the comments, tell me which type of sensitivity matched your test and how long you've been dealing with it. I read them. If this helped, hit the like button, subscribe, and share it with someone over 50 who needs to hear it. Take care of your teeth. They're irreplaceable. I'll see you in the next one.